it just, the research at least was showing that there's much less directional preference in the peripheral joints. And again, that wasn't what I was seeing anecdotally. So I think we just wanted to highlight that mostly because I felt it was going to be way higher than, the numbers on it. In spine, at least at the time, ranged from 60 to 78% of directional preference in spinal conditions. And in the periphery, it was between 2006 and 2012, the prevalence rate increased from 19% to 37%, so it's a 90% increase. So clearly, it was like something, people are learning it more, they're using it more, they're just applying it in a more effective way. But still, 37% is not what I see, and I thought that was quite low. So that was, I guess, just to see what's out there in a different joint. And then in thinking about the study design and, why that might be, why are people not finding it, right? A complex joint. And we'll get into this a little bit more, I guess, later too. But if you looked at just the research, there was only 2 risk procedures that were published, at least: wrist extension and ulnar deviation. And in the sample that we had, that would have only equated to 20% of our patients having directional preference. So I think that's really interesting, because if you can find these weird other obscure movements, you would classify them as inconclusive or send them back into the ortho world for Lord knows what could happen. They might be braced for months, they might have surgical intervention, they might have chemical intervention. And yeah, I just think that that's really interesting. So